Okay. Okay, thank you. So again, my name is Linda Schellenberg from CFS. Um, and we are in the New York City area as well as Long Island. And we have our fiscal intermediary CFS self-directed supports. And we often have questions from families about how to use CDPAP services. And it was wonderful that Megan reached out and was interested in joining us. So we typically have a monthly individual and family meeting, and we do different topics. And Megan had asked that we open this up to the broader community, not just our CFS families. So we're so pleased to have a great turnout, and what I'm seeing from the registration, people from across the state. So welcome to joining us here at CFS and learning about CDPAP. So I'd like to turn it over to Megan Shergill, who's the VP of CDPAP Services at Community Care Home Health Services, and she will be leading the session today. And just as another reminder, we are recording the session, so if you can please keep yourself on mute so everybody can have good audio. And we will be taking questions at the end, so feel free to use the chat if you have a burning question, or jot it down, and we will definitely save time at the end once Megan's through with her presentation. So I'll kick it over to you, Megan.
What a great introduction, Linda. Thank you so much. And like I said earlier, I think before we even started the recording, thank you to everyone who took the time out today to learn a little bit more about CDPAP Home Care Services. Like Linda said, my name is Megan Shergill. I'm the Vice President of CDPAP Services at Community Care Home Health Services. And the little fun fact is I actually used to work at the Center for Family Support as a direct support professional, as a community rehabilitation specialist with children with autism within their homes, assisting them with activities of daily living, like grooming, dressing, bathing, toileting, things like that. So the special needs community is near and dear to my heart. And now in the role that I'm in, I'm so pleased because as you can see today, with over 77 people already in today's workshop, we're able to reach a broader audience to help engage and educate people about the different home care options available to them. That's the purpose of today's workshop. CDPAP is a home care alternative to traditional home care services, and it's not right for everyone, but at the very least, people should know that it's an option available to them. So without any further ado, we're going to get started. And like Linda said, if you have any burning questions, please submit them to the chat box, and we will address all questions at the end. And we will be sharing the recording after the fact, as well as the slide deck after the fact via email with all of you. So I find it first helpful to provide you a little bit of context in regards to who we are at Community Care Home Health Services. We are defined as a fiscal intermediary, an FI, which essentially just means that we are the agency that processes the payroll for caregivers under the CDPAP program, the CDPAP Home Care Program. And currently, we service a large footprint of territory throughout New York State. We service all of Long Island, the 5 boroughs of New York City, Westchester County, Rockland County, Monroe, and Erie County. And very soon, we're anticipating to be granted an award from New York State Department of Health to service an additional 20 counties throughout New York State. So we'll be able to service approximately 40 different counties throughout New York State, which we are just so pleased and excited about. So beyond being a home care agency, a fiscal intermediary, we like to define ourselves as first mission-driven community advocates. What we do is always educating the community about the options available to them. I do a lot of different workshops, educational workshops and events for professionals and families. And I definitely recommend to write down my name and look me up on LinkedIn and Facebook because I promote all of our upcoming workshops and family-friendly and fun events all of the time, all throughout the state. And it's just so helpful to be aware of the different options available to you. So what I like to do, because I have a little bit of background in the special needs community, is there's a lot of different home care agencies out there throughout New York State. I think the last count was about 800 different home care agencies in New York State alone that provide CDPAP services. However, the majority of them are fluent in only the elderly community and how to direct them towards receiving CDPAP home care services. For some reason, it almost seems like the special needs community has been, almost like second place, not really their primary audience. And a lot of professionals don't even know how to direct the special needs community and the individuals with how to receive home care services. So thankfully, the fact that I have that background in the special needs community, myself and my team were very fluent and well-versed in self-direction and ComHab services, respite services, and how they complement and supplement services with CDPAP services. So that's what we're going to be talking about today. Beyond being a CDPAP fiscal intermediary, Community Care is also a licensed home care agency. What that means is that we're also able to provide certified caregivers to individuals needing home care services. So those certified caregivers are either personal care attendants or home health aides for individuals who have Medicaid. And if an individual does not have Medicaid, we also can provide private pay home care services or even companion level services. And beyond that, we also do provide also skilled nursing services. So I like to describe us as a one-stop shop for all things home care related. And even if you don't know what type of home care service is right for you, I just say default to calling our team. We can always tell you what's available, and then you can make a well-informed decision in regards to your home care services. But for the purpose of today's workshop, we're going to talk about CDPAP. It's an acronym. It stands for the Consumer Directed Personal Assistance Program. And what it is a Medicaid-funded home care program in New York State in which someone who has Medicaid can hire a loved one, someone that they already know, love, and trust, to be their caregiver, known as a personal assistant in this program. So this is an alternative to traditional home care services. Remember, traditional home care services is the home care service in which the home care agency sends a certified caregiver to the individual's home, a personal care attendant or a home health aide. That's traditional home care services. This is an alternative, CDPAP services, where the consumer, the person receiving the home care services, can choose who their caregiver is, as long as that caregiver is at least 18 years old and eligible for employment in the United States. There's very few exclusions with who can be the personal assistant. So this program helps to empower individuals and families. And I always say, if you like self-direction, you're really going to love CDPAP because the themes are very similar. Okay, so I always like to start with a little bit of background information in regards to how CDPAP originated. CDPAP began back in the 1970s by a group of individuals who were physically disabled. So think about individuals who had MS or who were paralyzed or who had Parkinson's. And essentially they wanted to have more autonomy and independence with directing their own services. They wanted the home care agency essentially to be hands off. They wanted to say, I want to be my own boss. I want to choose my caregivers. I want to train my caregivers. I want to supervise their work and coordinate their schedules. So that's what they did. They created CDPAP, the Consumer Directed Personal Assistance Program. And since it began in New York State, a consumer-directed home care program has since flourished to every single state in the United States. And I like to now usually pose it to the audience, meaning all of you, which state do you think has the highest volume of consumer-directed home care services? Please don't unmute yourself, maybe submit it to the chat box. Which state do you think has the highest volume of consumer-directed home care services? Any guesses? I see lots of New Yorks, California. Well, I'm very disheartened to know that it's actually not New York. However, that's where my job security comes in, because then I get to educate individuals about this home care program, but it's not New York. It started in New York, but the highest volume of consumer-directed home care services is actually in Washington State, which is surprising. And no one seems to know why. However, I digress. Another fun little fact that you can bring at your next dinner party is that Australia only has consumer-directed home care as the option. It's only consumer-directed home care. There's no option for traditional home care services where the agency sends a certified caregiver to the home. So it's very interesting that other countries are a little bit more progressive and maybe forward thinking on the same trend of letting the families or the individuals receiving the home care services be their own boss and their own decision makers in regards to their home care services. So CDPAP serves a wide variety of people needing home care services. If you recall, it started with the physically disabled community, and then it flourished to the elderly, the aging community, and then, of course, the special needs community, which I'll dive into in one of the next few slides. And lastly, the medically fragile community. So think about perhaps children who have tracheotomies or feeding tubes or ostomy bags or ventilators. They love this program, and I'll explain why in one of the next few slides. But for the purpose of today's workshop, I'm going to use all the different scenarios, or I'm going to describe the different scenarios available to you in the scope of a special needs setting or environment. However, it's very important to remember that even perhaps your aging parent could benefit from CDPAP services, or a friend who's aging, or a friend who is physically disabled could benefit from this program. Okay, so next I find it helpful to define who's who in this program. So when we say the consumer-directed personal assistance program, we're talking about the individual approved for home care services. The consumer is the person receiving the home care services. And remember, they have to have Medicaid. Next, there's a term known as the designated representative. Let me paint a scenario for you. Linda, let's say that you are looking to get services, home care services for your child, little Johnny. Little Johnny, you want him to have CDPAP services. Little Johnny's 8 years old. He can't be the boss of his home care services. He can't choose who his caregivers are, train his caregivers, supervise their work, or coordinate their schedules. However, Linda can take on the role of the designated representative who acts as the boss on behalf of the consumer, taking on all of those responsibilities, if not for the consumer. Oh, sorry about that. If not for the consumer. So again, now let's think about maybe a different scenario. Maybe there is an aging individual, like an aging parent that you have who maybe has dementia or Alzheimer's and is not considered to be alert and oriented and self-directing. They can't make decisions on their own behalf. Someone else can be assigned to be their designated representative so that they can receive all of the benefits of this amazing program. But instead of them being the boss, the designated representative takes on the responsibility of being the boss of their home care services. In addition, a lot of people think that the designated representative has to be a family member, and that's not the case at all. We have so many families. We have hundreds of families who, as their designated representative, is a family friend or a neighbor or a church member. The designated representative does not need to be a parent or a family member or the power of attorney or the healthcare proxy. And this title of designated representative is only the title and the ownership over this program only. It does not affect any other programs, Medicaid Support Services, anything else. Then we talk about who the personal assistant is, the PA. That's the caregiver in this program. So when you think about the term consumer-directed personal assistance program, it's the consumer who's directing the caregiver in this program. Lastly, there's the term FI, fiscal intermediary, and there's different types of FIs. For instance, the Center for for family support is an FI in regards to other Medicaid support services. However, community care, where I'm from, is a fiscal intermediary in regards to CDPAP services. And again, a fiscal intermediary is simply a term that basically means that we are the agency that processes the payroll for the personal assistants, the caregivers. And then that way it frees up either the consumer or the designated representative to act as the front of the house boss for all other responsibilities, choosing the caregivers, training the caregivers, monitoring their work and coordinating their schedules. And then we just process the payroll on the back end for their caregivers. So why do families love CDPAP? Well, remember, either the consumer or the designated representative takes on the responsibility of finding the caregivers, training the caregivers, coordinating their work, and supervising their work and coordinating their schedules. So there is an enhanced, a heightened level of independence and autonomy, as well as responsibility in this program. So this program is not right for everyone. I always say, if you are a type A person, such as myself, I can say that because I am one, this program's right for you. If you want the ownership over a program, if you like self-direction, you're going to really love CDPAP services. However, if you're easily overwhelmed and don't want to take on this heightened level of responsibility, this is not the program for you, and that's okay. Because at the very least, you should just at least know that this is an option available to you. And to that point, you can always enroll into CDPAP services. And if you're not satisfied or you're easily overwhelmed, you can simply transition over to traditional home care services. No big deal. We have plenty of families who maybe start with CDPAP services and then transition over to traditional home care services, where the agency sends a certified caregiver instead to their homes. And then sometimes they even go back to CDPAP services. But when we talk about who the caregiver can be in this program, believe it or not, it can be just about anyone, as long as they are eligible for employment in the United States and at least 18 years old, an adult. Other than that, there's no background check or drug screen that's required by New York State Department of Health. And I know that's pretty mind-boggling, because you're thinking these caregivers are working for a Medicaid-funded home care program, and there's no background check or drug screens required. Correct. But that's because either the consumer or the designated representative takes on the responsibility and the liability of choosing who the caregivers are. So like I said, this program's not right for everyone, but at least it's an option. The next thing I wanted to mention was, when you think about traditional home care services, where the agency sends a personal care attendant who's certified, or a certified home health aide to an individual's home, there's something called a scope of practice. Basically, what that means is there's a certain realm of items that that certified caregiver is allowed to do to assist the individual at home. And those things are called activities of daily living. The activities of daily living are essentially items or things that you and I do in the morning that we take for granted. For instance, making our bed, brushing our teeth, grooming, dressing, bathing, toileting, meal preparation, etc. All of those are activities of daily living. Traditional home care services, the certified caregivers are permitted to assist the individuals physically with assisting them with activities of daily living. Under CDPAP, the personal assistants, the caregivers, are also allowed to do those items. They're allowed to assist with those activities of daily living, as well as some skilled nursing tasks. So believe it or not, the non-certified caregivers, the personal assistants under CDPAP, are allowed to assist with things such as medication administration, ventilator care, wound care, tracheotomy care, feeding tube care, ostomy care, and others. And this is usually the point in the workshop in which people are giving me confused looks on their faces. How is it that a non-certified caregiver can do some skilled nursing tasks under New York State Department of Health? Well, it's because either the consumer or the designated representative takes on that responsibility of training and supervising the work of the personal assistant. So I hope that makes sense to everyone. Additionally, in CDPAP, when Medicaid approves a certain amount of hours for the individual, let's say little Johnny, Medicaid will approve a weekly bank of hours rather than a set schedule. So let's say little Johnny enrolls into traditional home care services, in which the agency sends out a certified caregiver. If little Johnny was to receive traditional home care services, Medicaid would say, little Johnny, let's just say you're approved for 40 hours a week, but you have to use the hours Monday through Friday, 9 to 5. It has to be that specific. However, in CDPAP, rather than having that specific set schedule from Medicaid, Medicaid instead approves a weekly bank of hours. So instead of Monday through Friday, 9 to 5, they say, little Johnny and family, you're approved for 40 hours a week, use them as you please. So that means that you could then set the schedule for your caregivers. That's part of the independence and autonomy of this program. So you could essentially have 0 hours on Monday, maybe only 2 hours on Tuesday, 12 overnight hours on Wednesday, and then 8 hours on Thursday, et cetera, as long as you don't go over 40 hours, or I should say the maximum amount of hours approved per week. So families love this, again, because of the flexibility and the ability to be your own boss of your home care services. Because I don't know about you, but at least in my own experience, no week is the same for me. Every week, week to week is different. We have different plans, different appointments, different responsibilities. So it's helpful to be able to have flexibility in directing your home care services. Now, one of the last items that people get really excited about when they hear about this program is the fact that there is no minimum age or maximum age of who can receive CDPAP services. So we truly service individuals who are 2 years old and 102 years old. There's no minimum and no maximum. But something to note is that once an individual is 21 years old, their parent can get paid to be their caregiver. Picture that. So essentially, the parents who are already doing this labor of love, once their adult child is 21 years old, they can get paid to be their caregiver. And you may be thinking, well, one would have to be the designated representative, right? Actually, no. You could assign someone else to be the boss, the designated representative, like a close family friend or a neighbor, to act as the boss of the home care services. And then both parents could sign up to be paid to be the caregivers. Picture that. Now, we also help families, like I said, who have children who receive home care services. So let's say little Johnny is 8 years old. Little Johnny can't have his parents be his caregivers. However, his grandmother could be his caregiver. His adult sibling could be paid to be his caregiver. His family friend, who's an adult, could be paid to be his caregiver. And the other thing I like to mention is, let's say you have a beloved respite worker or community rehabilitation specialist or ABA therapist, someone that your family loves dearly. Imagine this. You sign them up to be your child's personal assistant under CDPAP, and they would work then the hours that they're not currently working, under the other Medicaid support services. Maybe they clock in and work the ComHab hours, and then they clock out, and then they clock back in to work the CDPAP hours. If you do that, then you reduce the amount of people coming in and out of the home, reducing the amount of people coming through the revolving door. Because at least in my experience, when I was working as a community rehabilitation specialist, I mean, you parents of special needs children are superheroes. The amount of different professionals that you have to coordinate coming in and out of your home, it's overwhelming, right? So any opportunity to limit who's coming in and out of the home, or perhaps who's already living within the home, to be the caregiver of the child or the individual receiving home care services, that's a win, especially when you're talking about, or when you're considering individuals maybe who have behavioral issues when they meet new people. This is such a great program because then, like I said, you reduce the amount of people coming in and out of the home. So how do you get started if you're encouraged by what you've learned so far? For CDPAP services, CDPAP is a home care program that's Medicaid funded. So numero uno, the individual that you want to have home care services has to first have Medicaid. And if you don't have any resources to do that, you can certainly call our team. My contact information will be on the last slide. and we can help connect you with different resources to help you or a loved one obtain Medicaid. So first, you have to have Medicaid. Secondly, you have to call an organization known as the New York Independent Assessor, or also known as NYIA, N-Y-I-A. And like it sounds like, they are an independent assessor from New York State whose sole responsibility is to assess individuals to see if they are appropriate for home care services and how many hours of home care services will be granted to the individual. So there's always two assessments. The first assessment is to see first if the environment is safe and if the individual is appropriate for home care services. So when we talk about a safe environment, typically they're just assessing to make sure it's not a hoarder situation or something like that. The second assessment is always then a calculation of how many hours they're actually going to approve on a weekly basis. Something that our team does at Community Care that other agencies don't do is, as a courtesy for free, we help prepare families prior to these nursing assessments so that they are well prepared with how to best tell their loved one's story prior to the assessment. Because if you say things the wrong way during the nursing assessment, you will not be granted home care services. And why is that? Well, I don't know if you've read or seen the news as of recently, but New York State right now is in debt when it comes to Medicaid. We're in the red. So when these nurse assessors go out to do these assessments to see if individuals are appropriate for home care services, they're getting a lot of pressure from their supervisors to keep the amount of hours that they approve low for obvious reasons, or to find any justification to not approve home care services at all. So what we do is we help remind families during a quick 15-minute preparation phone call that CDPAP is defined as a task-based service. It's a task-based program. What that means is that you have to prove during the nursing assessment, while being truthful, of course, that the individual needing home care services needs physical assistance with at least 3 activities of daily living. So again, those are things like grooming, dressing, bathing, meal preparation, etc., toileting, as well as some skilled nursing tasks like ventilator care, medication administration, wound care, tracheotomy care, feeding tube care, ostomy care, etc. And what we do when we help prepare families is we actually send a list of all the different tasks that are within that CDPAP personal assistant scope of practice so that families can see that list prior to the nursing assessment to identify, little Johnny does need physical assistance with toiling. Okay, check. He does need physical assistance with medication administration. Check. So that way, during the nursing assessment, they have a laundry list of different items to mention to the nurse so nothing gets missed. In addition, in my experience doing this for over 10 years now, home care agencies and the New York Independent Assessor are usually more fluent in guiding and directing individuals needing home care services that are within the elderly community, not so much the special needs community. The special needs community tends to have something called an OPWDD waiver, which stands for the Office for People with Developmental Disabilities Waiver Program. And when they have a waiver for their Medicaid services, there's something called a Code 95. Essentially, what that means is that if you were to call a home care agency, such as Community Care or another one, and you were to provide your child's Medicaid ID number, for instance, what the home care agency would do is run the Medicaid ID number to make sure that that individual can receive home care services, that they're eligible for home care services. Home care agencies that are not fluent in the special needs community will see that Code 95 and say, oh, I can't help you, or I don't know how to help you, or we're not able to provide you home care services. And what has been reported to me is that the New York Independent Assessor team also is not fluent enough in the special needs community. I heard from dozens of families that called the New York Independent Assessor to schedule a home care assessment, that the New York Independent Assessor told them that their child was not eligible to receive an assessment, and that's not true. Unfortunately, they're just not well versed in the special needs community. So what did I do on Megan's little community care crusade? I called New York State Department of Health and with my little pitchfork, and I said, the New York Independent Assessor team is telling families the wrong thing. Everyone at the least is eligible for a home care assessment. Maybe not everyone is eligible for home care services, but at the very least, everyone's at least eligible for a home care assessment. And New York State Department of Health, wouldn't you know it, affirmed what I said and said, yes, you're right. The New York Independent Assessor needs further training and education when it comes to different waiver programs and codes and the special needs community. So what they did was they provided me this email address that you see at the bottom of your screen. And I definitely recommend taking your phone and taking a picture of this email address, because they recommended that if you should call the New York Independent Assessor, and if you're told that an individual is not eligible for a home care assessment, to email New York State Department of Health at this email address right away, and they'll rectify it. They'll make it right and make sure that you get that assessment. And I've done this with dozens of families. To New York State Department of Health's credit, they are very responsive. They've literally responded to us every time within 2 hours. So I definitely recommend filing this little email address away for future reference if you're interested in CDPAP services. Okay, so if you've liked what you've heard so far in regards to CDPAP services, and you're not convinced to go enroll into community care, which is where I work, here are my recommendations in regards to how to find the right agency for you. Because my mission is to empower individuals with the education and the knowledge that they need to make well-informed decisions regarding their home care services. The very first thing I always recommend to families and professionals when they're shopping around for a home care agency is to, when you call the agency, make sure that the agency is not pressuring you to choose a certain type of home care service. Meaning they're not pressuring you to choose CDPAP services or traditional home care services. They may pressure you to choose one service over the other because they're reimbursed at a higher rate from Medicaid for one service over the other. And so that's a very selfish reason for them to push a certain type of services on you. You heard me say a few times now that CDPAP services are not right for everyone, right? And that's why you have to make a well-informed decision in regards to whether this is right for you. There's a heightened level of responsibility involved in this program. But that's why I recommend calling the community care team, because we can talk about your different options and you can choose what's best for you. So make sure that when you're shopping around for different home care agencies, that you're not being pressured to choose one service over the other. Now, the next thing I recommend is to make sure that the agency you choose is fluent in the rules, regulations, and laws surrounding this program. For instance, by a show of hands, has anyone here heard of the 21st Century Cures Act? Now I see lots of shaking heads. Well, that's where, again, where my job security comes in. So the 21st, oh, someone raised their hand, excellent. So the 21st Century Cures Act, essentially in a synopsis, means that any Medicaid funded program requires the caregivers to clock in and clock out using the consumer's house phone or using their own personal cell phone using an app with a GPS location indicator to prove that the caregiver is where they are when they say they are providing the services. This now surpasses what used to be done, which was submitting timesheets. And as you can imagine, this program used to be very, heightened with fraud and Medicaid abuse, because it's usually loved ones caring for loved ones, families caring for families. So in the past, certain families may say something like, oh, sure, my sister worked for my son yesterday and submit a timesheet. And that's very sketchy and that's against the law. And so to prevent that from happening moving forward, New York State issued this 21st Century Cures Act, which requires that all caregivers under a Medicaid program use electronic visit verification to prove that services were rendered. So if you shop around and the agency says to you, oh, the caregiver can use timesheets, that's a red flag, because it's literally a federal law that timesheets are no longer acceptable. They have to use electronic visit verification as per the 21st Century Cures Act. Next, I recommend that you do a simple Google search I don't know about you, but even when I search where to go out to dinner with my husband and my 15-month-old after work, I do a Google search. I want to see the ratings. I want to see the reviews. Even when we installed the fence in our backyard, we did a Google search. You can learn a lot from Google. And what I recommend is that you Google our team. Simply type in community care, home health services, Smithtown, because that's where our corporate office is. And you'll see, as of I think this morning, 248 reviews and a 4.8 out of 5-star rating. And I think that speaks volumes, because let's just be honest, people tend to only leave reviews when they're dissatisfied, not always satisfied. So that's very telling. So definitely do a Google search of the agency, and also connect with the agency and its leaders on social media, whether it's LinkedIn, Facebook, Instagram. You heard me mention at the beginning of this workshop, I encouraged you to link with me on Facebook and LinkedIn, because I often promote other educational workshops, family-friendly fun events, and all of our events are either virtually or in person throughout the state of New York. So there's a lot to be learned, and you just want to make sure that the agency that you sign up with is well-versed, responsive. That's the number one complaint that I get from families when they switch over to our agency, is they say, wow, I can't believe you actually answered the phone, or wow, I can't believe you called me back. My current agency never gets back to me. You want to make sure that from the get-go, they are very responsive, because if you sign up with the agency, you're with them. It's pretty challenging to transfer once you enroll into an agency. Has anyone here, by a show of hands, heard of a website called Simply CDPAP? No. Again, neither did I until about a couple of months ago. So in my role, I answer the phone often from families and professionals who have questions in regards to CDPAP services. And so one family called me, and I always ask, how'd you hear about us? Just to kind of learn where the trends are. And this specific family said, oh, I actually heard about you from simplycdpap.com. And for a brief moment, I clutched my pearls, and I was very, very nervous, because I had never heard of this website before, and I was worried about what are they saying about us on simplycdpap.com. So I recommend that you go there. I have since learned that it is a neutral website in which they review and rate different CDPAP home care agencies. I believe that they reviewed 8 or 9, and they're all the big ones, and you're going to recognize a lot of the names on there. And so what they did, what you'll see on the right-hand side of your screen, is they rate all of them based on different criteria: the pay rates and the benefits, Google reviews, Better Business Bureau complaints, legal lawsuits, and Glassdoor reviews. So of the 8 or 9 home care agencies that they review, does anybody have any guesses of the only agency that they marked as highly recommended? It was Community Care. Of the 8 or 9, it was only Community Care that they highly recommended, and that's what you see here on your screen. The other agencies, they either marked as do not recommend or average. So again, I just think that that speaks volumes. And like I said, this is a neutral website that I knew nothing about. So definitely recommend that you look at it whenever you can. So when you think about the different home care agencies, they're all essentially the same, because they're all just processing the payroll for the caregivers. There's not a whole lot of differentiating factors other than how responsive and knowledgeable they are about this program, which I'm hoping that you're learning from me today, that I can be pretty knowledgeable about the program. And secondly, what benefits are in it for the caregivers? Because when families are shopping around to different agencies, they want to know that they're getting the best benefits for their caregivers, because oftentimes the caregivers are people like their friends or their family or loved ones caring for their loved ones needing home care services. So community care has extensive benefits. To my knowledge, we are the only agency that provides a 401k for the caregivers. Picture that. I'm sure you know of someone who has had to quit their job to maybe care for a loved one needing home care services. Imagine their ability to enroll into this program, to not only get paid to do that, something that they're already doing, but also to receive a 401k and health insurance. We offer that as well. We also offer vacation pay. and weekly pay, which is huge because the majority of home care agencies offer a bi-weekly pay, and that makes a difference for people who are living paycheck to paycheck. Additionally, something that I get very excited about is we offer something called the Employee Perks Program, which is a program in which individuals, the caregivers, can receive discounts on over 30,000 different retail items, including motor vehicle purchases, groceries, childcare, movie tickets, vacations, travel, things like that. And I get excited because I also get those discounts being a community care employee. So they're real. I got a discount on my phone bill. So it's a great thing. Definitely recommend. And when we talk about what the pay rates are for the caregivers, that's going to differ depending on the territory, simply because of minimum wage differences. So for instance, for the Long Island area, we pay $19.72 an hour, and that's also for Westchester. For the New York City area, we pay $20.59 because of minimum wage differences. And then for the Western New York area, so think about Erie County and Monroe County, we pay $16.20 an hour because of minimum wage differences. Other agencies may pay 50 cents more. However, do they offer the comprehensive benefits package that community care does? Not so sure. And I also recommend, even if they say that they're going to pay 50 cents more, you have to make sure that the team, the home care team, proves themselves as accessible and responsive, and that they're going to pay you timely and accurately every week. Because it's one thing to promise that they're going to pay you 50 cents extra per hour, but it's another thing to not get paid timely and accurately, and at the end of the day, a 50 cents difference per hour after taxes is only 33 cents difference per hour. So I like to kind of break that down for families and professionals, because sometimes they shop around and they hear what we offer, like for instance, $19.72 per hour on Long Island versus another agency that offers $20.22 an hour. It's just 50 cents. And after taxes, it's just 33 cents an hour. So I just recommend that you really think about all the different benefits provided by the home care agency. So what you see on your screen now is an old snapshot of our Google rating, because I believe, like I said, as of this morning, we have 248 reviews and a 4.8 out of 5-star rating. These are just a couple of real reviews. On the top left-hand side, you're going to see our team's contact information. And I just definitely recommend, if you have any questions, reach out to our team, even if it's not for CDPAP services. Like I said, we are one-stop shop for all things home care related, and we're just happy to help. So Linda, do you have anything to add before we jump into the questions?
No, I was just looking at the questions and encouraging people to jot them down. No, I think as we go through, I think we'll be able to answer them together. Do you want me
Perfect.
to read them to you, Megan?
No, I think I got it. Thank you,
Okay,
though.
great.
I appreciate it. So one of the first questions that I see is, does the legal guardianship qualify to be the designated representative? Technically, yes. The designated representative can be the legal guardianship, because the title of the designated representative is just a title only privy to this program. It doesn't change any other like paperwork or titles in any other facets. And then I see the next question, can the designated representative, the boss, also be the caregiver? No, that's a conflict of interest, right? The boss can't also be the caregiver. So that's one of the few exclusions. Caregivers in this program can't be the boss, as well as they can't be the legal spouse of the individual receiving the home care services, the consumer. And that's for obvious reasons. That's just a conflict of interest. Somebody next asks, can I use the same FI that I use for my son's self-direction? That depends. Certain FIs that provide self-direction also are approved and provide CDPAP services, and others don't. Like for instance, Linda, correct me if I'm wrong, but I don't believe the Center for Family Support provides CDPAP services, correct?
That's correct. That's correct.
Correct. So like this would be a prime example. The Center for Family Support provides other Medicaid support services like self-direction, but not CDPAP services. So you may have to, do a little bit of research. Next question that I think I answered, can the caregiver be a parent? Yes, only when, I should say, the child is at least 21 years old. Next question, will be taxable and have to report to the IRS? Yes. So I think what the question that you're asking is, are the personal assistants, the caregivers, like 1099 employees, like contracted employees, or are they subject to state and federal taxes? They are subject to state and federal taxes. So they are considered to be employees of community care. Okay, so here's a good question. How is CDPAP approved with managed Medicaid versus straight Medicaid? So to clarify this question for some people who may not be aware, I like to create a visual for some people. Let's picture an upside down triangle, okay? At the base towards the top, the widest breadth, let's consider that home care services like CDPAP is paid by New York State Medicaid dollars. That's at the very tippy top. So New York State Medicaid dollars then always gets trickled down to two different types of payer sources for home care services. It's either through the local Department of Social Services, also known as straight Medicaid, or a managed long-term care insurance program, also known as an MLTC, a managed long-term care program. So there's two different payer sources, either the local Department of Social Services or the insurance company. How do we identify who the payer source is for an individual? Well, typically the aging community, the elderly community, is prompted to enroll into a managed long-term care insurance plan, like Aetna, Fidelis, Visiting Nurse Service. You've heard of some of these before. They're prompted because they are of a certain age range, the elderly community, and have a certain income threshold. So they're prompted to enroll into a managed long-term care insurance plan. When we think about individuals such as perhaps a child with special needs, they're not going to be prompted to enroll into a managed long-term care plan, an insurance company, because they're a child. And typically these insurance companies have a minimum age requirement of, I believe it's either 55 or 65. So if an individual gets approved for Medicaid, it's typically because they're enrolling into a waiver program, such as there's a few waiver programs, either OPWDD, the Office for People with Developmental Disabilities, or TBI, Traumatic Brain Injury, or the Nursing Home Transition and Diversion Waiver Program, which is for the elderly community. If you're enrolling into a waiver program, the only option then is to enroll into the local Department of Social Services. That would be your payer source. So if you're thinking of that upside down triangle, New York State Medicaid dollars down to two payer sources, the insurance company or your local Department of Social Services. And then those payer sources pay the home care agency, and the home care agency then pays the caregiver. Does that make sense? Yeah. I usually, when I speak to people in person, I draw an upside down triangle. If you want me to send you a diagram, I certainly can. Just email me. Okay, next question. New York City CASA, C-A-S-A, requires set hours for CDPAP. Can we discuss the hourly bank versus New York City CDPAP required set schedule? So I understand what you're saying, that it's actually also known as the HRA in the city. Some payer sources, like the local Department of Social Services for different territories, like Westchester, I've heard, as well as New York City, when they issue the authorization for home care services, sometimes they make it a set schedule. Why do they do that? Because they're not well versed in CDPAP services. So they default to creating their authorizations like they would for traditional home care services. So what our team has been very successful in doing is rallying with the family to call the home care payer source, the local Department of Social Services like CASA, HRA, the DSS office, and explaining to them that as per New York State Department of Health, it's supposed to be a weekly bank of hours. And I can certainly send literature and links for the New York State Department of Health website that explain that it's supposed to be a weekly bank of hours if you need. Somebody asks, what is the maximum amount of hours like allowed or approved per week? That depends on how you answer the nurse assessor's questions. That's why I recommend that you link with a member of our team prior to the nurse assessor assessment, so that you can say things the right way. We have individuals who truly only receive 2 hours a week versus individuals who receive 168 hours per week, which is the maximum. Think about 24 hours a day by 7 days a week equates to 168 hours per week. But you have to say things properly while being truthful, of course, during the nurse assessor assessment to hopefully get the highest amount of hours. Okay, so here's a scenario that somebody asked in the chat. They say, my 22-year-old son receives 16 hours a day of private duty nursing through Medicaid. Not all shifts are covered. Can I, as his mom, get paid through CDPAP for the hours that I don't have nursing? Yes, only if your son is at least, oh, you said 22 years old. Perfect. Yes, as long as the child is at least 21, yes. We have so many families who struggle with their nursing agency covered under Medicaid to staff the shifts with a nurse because of just obvious reasons, the staffing shortage right now in New York State. So we have so many families that instead of the nursing services, they'll fill the void of the shifts that they can't staff with CDPAP services instead, because it's all covered under Medicaid. So you just simply have to have a conversation with your case manager, either at your insurance company, like I discussed, or the local Department of Social Services, and explain that that's your wish. And then you can enroll into having those skilled nursing services, or I should say the private duty services, as well as the CDPAP services. Next question, can the parents only get paid once the child is 21 years old? Correct. The child has to be at least 21 for the parent to get paid to work as the caregiver. Good question. This is actually the first time I've seen this next question. Can you roll over the hours to the next week if you don't use all of the hours for the current week? That would be nice, but no, they don't allow that. However, there is something called standing orders. So let's say that your child goes to school during the school year, the school season, I should say, during the school season. Once summer break comes around, the local Department of Social Services typically will approve a higher amount of hours for the summer season, or even during school breaks, like winter session or whatever, or like the holiday session, so that the time is supplemented with the care that the child's not in school, so they get an increase of home care hours during those certain periods of time throughout the year. Okay, I just want to see if I understand this question properly. Over 21 and not self-directing, can the parent or legal guardian be the caregiver? Yes. However, someone else has to be identified to be the designated representative. And I see the next part of this question says, we were told no by the local Department of Social Services, but they did not provide you with regulation citations for their position. So New York State Department of Health says that the legal guardian can be the caregiver, and someone else can just be assigned to be the designated representative if the individual receiving the home care services is not considered to be alert and oriented. However, different departments of social services, let's just say Nassau County, DSS, for an example, may have their own internal policies. So they are allowed to have their own internal policies that kind of supersede what New York State Department of Health says. So even though New York State Department of Health does not require or does not allow the legal guardian to be the caregiver, I'm sorry, even though New York State Department of Health does allow the legal guardian to be the caregiver, let's just say Nassau County DSS may say that for their own reasons, their internal policy does not allow it. So I hope that makes sense. So you really have to call your nurse case manager at the local Department of Social Services to see what their positions are, what their policies are. Can one disabled person have more than one personal assistant? Yes, we always recommend to the families that we support to enroll as many caregivers as you can, because remember, when your primary caregiver calls out, it's up to you to already have someone else enrolled to be the backup caregiver. And things are going to happen, right? Weather emergencies, true emergencies, sick days, vacation days. And And in this program, the agency is not permitted to be involved in finding caregivers, training other caregivers, or hiring of any caregivers. We can't screen or help you interview anyone. So that is the heightened level of responsibility. But yes, we always recommend to have more than one caregiver enrolled. Someone says, my son is 26 and he's only getting 20 hours per week. How can he get 40 hours? The only time that an individual is eligible for a new assessment, I believe, is every 6 months, or if there's a significant change in clinical condition, which is the worst thing that could happen. That's like saying that your son all of a sudden now gets seizures when he never had seizures before. We don't want that to happen. But that's truly the only time that you're eligible for a new assessment. And what I would recommend to this person who asked this question is to call our team so that we can prepare you for the next assessment to say things properly to hopefully obtain the best outcome, an increase of hours. But we have to be truthful, so we can help you if you call us. Okay, so the next question is, how does approval of CDPAP affect self-direction funding? Great question. A lot of professionals and families don't realize that there's two separate Medicaid budgets. There's the self-direction budget, and then there's the home care budget. And they're both under Medicaid, but they're completely separate. A lot of families are apprehensive to enroll into CDPAP services because they think it's going to eat away at their self-direction budget. And that's not the case. They're completely separate. So I always encourage families to utilize both supportive resources, not just one or the other. Okay, here's another one. I called the New York Independent Assessor several times, and I keep being told that they will not evaluate her because she's under 18. So for an individual who's under 18, the first assessment is always going to be through the New York Independent Assessor. The second assessment will always be through the local Department of Social Services. So depending on where you live, simply do a Google search of, your county and then Department of Social Services, call their phone number, and they can help coordinate a home care assessment for that individual under 18. And if you have any issues, I will send this slide deck via email to everyone after this workshop concludes, and you'll have the email address to email New York State Department of Health with any issues that you have with the New York Independent Assessor. Here's a scenario. Someone says, my 22-year-old son lives in a group home in Orange County, but comes home to family in Rockland County every weekend. He used to get CDPAP when he lived full-time in Rockland. Would he still qualify for CDPAP on the weekend time? No. Medicaid will only pay for either the group home or home care services, even though I understand it's split. They'll only pay for one or the other, unfortunately. Are the hourly rates for CDPAP higher than self-direction? To be honest with you, I think the hourly pay rates are lower for CDPAP, but that still should not discourage you from utilizing the supportive service, because we, well, for one thing, community care, we are a member of an organization known as the CDPAP Association of New York State. It's the largest advocacy group for CDPAP in New York State, and we routinely go to Albany to lobby for higher wages for the caregivers. But regardless, typically, families or loved ones are already providing the care for the individuals, so might as well get paid for the care that you're already doing. So the pay rate may not be grand, but like I said earlier, community care offers the 401k, the health insurance, employee perks program, vacation pay, weekly pay, etc. So I hope that that's enticing enough to you to consider enrolling into the program, even if the pay rate's not what you wanted it to be. Somebody asks, can we use the same report for his ISP where they ask these same questions? Linda, this may be a question for you. I'm actually not familiar with what an ISP is.
It's the current ISP term in OPWDD is a life plan, and a life plan is an overarching plan for the individual. That would probably provide some of what you're looking for, but for CDPAP, as Megan mentioned, it's really focused in on personal care. So really that part in terms of the safeguards and the needs of the individual, you might gather some of that information from the life plan, but it's going to be a different scope.
Yes. So great. Thank you, Linda. Great point. I actually meant to mention this earlier. When you think about self-direction services, it's an umbrella, right? And some families and individuals use community rehabilitation services. I used to be a ComHab worker myself. Community rehabilitation services, its premise is to try to get the individual towards as much independence as possible with completing their own activities of daily living, right? So ComHab, you're trying to get the individual towards independence with them completing their activities of daily living, versus CDPAP, you're proving during the nursing assessment for home care services that the individual needs physical assistance with activities of daily living. So someone can rightfully receive both types of services. For instance, let's say my little daughter, Sally, has the ability to get towards independence with preparing her own meal. However, she needs physical assistance with toileting. So that's the home care services. So people can certainly receive both, but you just have to kind of reframe your mindset when you're going into the home care assessment that you have to prove that the individual needs physical assistance with at least 3 activities of daily living. Someone says, I was told home health aides are not allowed to be alone with the client needing services. Are CDPAP employees allowed to be alone with the client? I'm not sure who told you that home health aides are not allowed to be alone with the client. They certainly are, as well as CDPAP personal assistants. They're allowed to be alone with the client. Someone asks, is there a timesheet exemption for a live-in personal assistant? No, they are still required to clock in and clock out using the consumer's house phone or using a mobile app on their cell phone. Oh, someone says, can you write down your Facebook so that everyone can link with me? Just simply search my name, Megan Shergill. It should be on your screen where my video is. Someone says that they tried the website simplycdpap.com. Maybe it didn't work. It should be www.simplycdpap.com. I know a few weeks ago it was under like revision, so you may get an error message, but that's why I did the screenshot. Let me go back of what they previously said, this little screenshot. So if it doesn't work today, maybe try it again next week. Okay, someone says, I'm part of CDPAP and I'm hired for a year. What is the process for recertification? There's no recertification. Maybe what you mean is you want to make sure that your compliance items are up to date. I would suggest that you call our team or contact our team, and you should see my contact information in the flyer that was previously sent out for this workshop. But again, I'll email everyone after the fact too, and we can discuss these specifics. Someone says, I'm still slightly confused about who qualifies to be the caregiver. Can parents be the caregiver for someone under 21? No. So if an individual is under 21, any other adult can be the caregiver as long as they're eligible for employment in the United States other than the parents. So we have individuals who are maybe 19 years old who have the adult sibling act as their caregiver, or have their grandmother or aunt or a ComHab worker act as their caregiver. But if they're under 21, the parent cannot be the caregiver yet. Someone says, can divorced parents who share custody of their child both receive CDPAP? That would be honestly a question for your nurse case manager at your local Department of Social Services. They're the ones who approve the location of where the services are to be rendered. We do have one family out of hundreds of families that we serve who actually has that kind of split approval. But again, it's up to the local Department of Social Services. Oh, someone says, can you change your CDPAP agency? Yes, and I encourage you to consider changing to community care if you've been satisfied with this presentation. And do we accept transfers from other agencies? Yes, of course we do. Someone asks, one of the pre-approvals of CDPAP is nursing care. What if my child doesn't currently require nursing care, but does require assistance with all daily or activities of daily living? So the requirements for CDPAP is just that you're approved for Medicaid and that you prove during the nursing assessment that you need a physical assistance with at least 3 activities of daily living, grooming, dressing, bathing, toileting, meal preparation, etc. It's not a requirement that you need some skilled nursing care. That's just a bonus. I hope that makes sense. Does our agency deal with overtime? So what this means, what this person is asking is, do we permit the caregivers to work over 40 hours? No, we don't, because just candidly speaking, we're paid from New York State Medicaid and they don't reimburse us enough to warrant or to justify us paying time and a half, which is required by law whenever the caregivers work over 40 hours. So if you shop around, you'll see that many other agencies as well, just they don't have it within their budget. They would actually lose money like we would if we allowed people to work over 40 hours.
Megan, can I just jump in for a second with
Yes.
this? I think, CDPAP is an excellent complement to self-direction, and this question is one of the reasons why we do find some folks that need a higher amount of support. They might have CDPAP for some of the hours. They might have ComHab for some of the hours. They might have respite for some of the hours, and the complement of the three service types really allows for the full schedule. And if you have a CDPAP FI that's different from your self-direction FI, then the one employee can work over the 40 hours without incurring overtime because they have two different employers.
Exactly.
That's an option.
Well said, Linda. Well said. And that is a true scenario that so many families lean into, especially if you have a beloved employee already as like your ABA therapist or your ComHab worker or your respite worker. That's a great option to provide to them if they want to make extra money. Okay, so someone says, my child was approved for CDPAP. However, we were informed that she has to have straight Medicaid. We currently have managed care Medicaid. Just what I would recommend for that, just call our team and we can look up your specific Medicaid details and then guide you in the right direction. What is the compensation for the fiscal intermediary representing CDPAP? How are they paid and how frequently? Every home care agency providing CDPAP services has a different frequency of which they pay the personal assistants and a different benefits and compensation package. So our organization has different wages, like I mentioned earlier, as well as all those different benefits that I mentioned earlier. And we also offer the weekly pay, which is unique because most agencies offer a bi-weekly pay.
I wonder,
Good question.
Megan, if he means, I wonder if he means how are the FIs, how are you paid?
Oh, did not even consider that, Linda. Sorry. How are we paid? We are only paid when services are proven to be rendered. So what does that mean? That means that once we obtain the clock in and clock out information, we collect that shift that's been worked, we send it over to New York State Medicaid, and we get reimbursed. It's known as a fee for service. Thanks, Linda. Next person asks, does the designated representative, the boss, get paid? That's a common question that I receive, and no, they don't get paid. It's not like self-direction, in which I understand that sometimes I think that person can get paid if applicable.
No.
No? Oh,
No.
someone said to me, like, if you're like a designee or something like that, they can get paid. I'm not really sure how that works, but no, the designated representative, the boss, does not get paid, only the personal assistant. Do we help individuals with the enrollment process? Yes, of course, we do that. That's exactly what my team and I do. We help people enroll into CDPAP. Okay, so someone says, I'm a social worker for the Department of Social Services. I have many families that will benefit from CDPAP. The majority of the population I serve are children with special needs. The only way for children under 18 to have access to CDPAP is through the OPWDD waiver. My understanding is typically, obviously they have to fit the criteria for the OPWDD waiver or a different waiver like a TBI waiver, or I actually have families who upon discharge from, like for instance, I have a friend who had a baby very prematurely. I think it was like 21 or 22 weeks. And unfortunately that child was in the ICU for a period of about a year and a half of the first year and a half of life. Upon discharge, that child was approved like emergency Medicaid because that child went home with a trach. And so instead of nursing services, my friend enrolled into CDPAP services so she could hire the caregivers to take care of the tracheotomy. So I understand that there are different avenues for individuals to receive Medicaid if they're under 18 years old. It doesn't have to be only through the OPWDD waiver program. Someone asks, over 21, self-directing and non-self-directing, question mark. I have to assume that that question asks or means if you're over 21, can you receive these services if you're self-directing and non-self-directing? Correct. So let's say you're over 21 and the person receiving the home care services, if you're alert and oriented, like let's say you have a physical disability like MS, you're paralyzed, Parkinson's, something like that, and you're self-directing, yeah, you can enroll into CDPAP services. If you're not considered to be alert and oriented, like perhaps you have a developmental disability that would prevent you from being alert, being able to self-direct these services, then you would have to have a designated representative act as the boss of the home care services. Okay, when you are on vacation, can you still get paid as the personal assistant? Only if the agency that you enroll into offers vacation pay, like community care.
Does that mean, Megan, maybe if you're not providing
Oh,
the service in the home, but rather the personal assistant comes with you, let's say on a trip to another state, how would that work?
good question. Look at you translating these questions for me. I'm taking it so literal, but yes. So it depends on, to be honest with you, on the payer source, meaning you have to call your case manager either at the managed long-term care plan or the local Department of Social Services, respectively, whichever one applies to you, and ask for permission. Because we do have some case managers that say, yes, of course, and others that say, no, the services have to be rendered in New York State because it's a New York State Medicaid funded program. Let's see. I'm seeing some questions that are very specific and I don't really want to dive into it just in the interest of everyone's time. So what I would recommend is reach out to me after this workshop and we can discuss the details. Linda, are there any generalized questions that you receive often, any FAQs that I can help answer?
I think you covered most of the general ones. I think, most of what what we hear are more of the specifics and I guess just a pointer. I think I've heard also families that use CDPAP because in self-direction we do have to go through a pretty thorough OPWDD requires us to go through a thorough vetting process for employees. Some families will start the employees in CDPAP so that they could get them starting to work sooner, try them out, and then also onboard them in with the self-direction, either ComHab or respite. So it's a good way to access the service. It's also a good way to look at maybe short-term tasks like assistance for an hour in the morning. Things that maybe wouldn't necessarily fit in to the ComHab program per se, and you wanna it's really focused on personal care. I think people use that service. But
Well
no, I
said.
think you handled most of the questions that come that I've heard of.
And I'm so encouraged to see so many questions. I can't stop scrolling. There's so many questions, but a lot of them are very specific. So I just recommend reaching out to me after this and we can talk details. But I did see a couple of questions of people who logged in late. Yes, the session is being recorded and we're going to send out the link after the fact via email to everyone who RSVP'd, as well as everyone's going to receive the slide deck that I shared today. And if you would like the list of all of the tasks that are underneath the scope of practice for personal assistance, please reach out to me and I can share that list with you. And that helps families prepare for the nursing assessment to be eligible for home care services. Is there anything else that you would like to address, Linda?
No, I think what we'll do too is I'll download the chat and we could take a look and see if there's been any questions that we might have missed that we can answer for you. But yeah, no, I think Megan, this was extremely helpful, very thorough and clear. And I hope the viewers also agree. And then, like you said, just to reiterate, we'll have this up and recorded. We'll send the link. We will, Megan's going to send the slides, which will have her contact information. And yeah, I think that's about it. I just wanted to say thank you so much, Megan. Thank you, everybody, for taking time to come. And you could feel free, once Megan shares out that information, if you want to pass it on to people that might also want to watch the video, that's fine as well.
Well said, Linda, because maybe you watch this and for your loved ones, CDPAP is not right for you and your family, but maybe you know someone in your social circle or within your family that could benefit from these services. Remember, it's not just special needs, it's the elderly community, physically disabled, and then the medically fragile community with tracheotomies, ostomies, ventilator care, things like that could benefit from this program. Thank you all so much. Please, when I email you, feel free to share the slide deck and recording with anyone, professionals, families, friends, whoever. Linda, thank you so much for helping to organize this, and I hope to hear from a lot of you. Thanks again.
Thank you. Take care.
Take care. Bye-bye.